Medical laboratory science is not an alternative to medicine. Medicine has been in existence for decades, for years, for centuries. It is also known as the bedrock and background of medicine. I have like different areas in medical laboratory science, just like there are different areas in medicine. There are obstetrics and gynecology, there's pediatrics, we have the histopathology, we have the hematology, immunology. Check it out! Hi guys, welcome back to my YouTube channel. If you are seeing my face for the very first time, hi, my name is AYOMIDE. I film about lifestyle, career, self-development and every other good stuff. If you're new here, please do subscribe to my channel, check out some of my other content. If you're a returning subscriber, hey loves, how are you doing? Thank you for always coming back, thank you for always staying tuned. In today's video, I'm going to be talking about a topic that is related to medical laboratory science. As you guys can tell from the title, I'm a medical laboratory scientist. I'm sure you guys will probably be wondering why this topic. Medical laboratory science is not an alternative to medicine. Ask me why. Okay, a couple of times I've seen people that wanted to like study medicine go for medical laboratory science because they think that is the next course to medicine. See, that is like the misconception. I don't know why people don't understand that medical laboratory science and medicine are two different professions when it comes to medicals, and these two professions saves lives in their own different ways. Okay, so now I'm going to like analyze what medical laboratory science is and why it is not an alternative to medicine. Medicine has been in existence for decades, for years, for centuries, if I do say so myself. But medical laboratory science has to be like that young profession, even though it has been in existence for years as well, but it is not as common or it is not as popular as medicine. So a couple of people that want to study medicine, by the time they make an attempt and it fails, you hear people advising them, oh, you can as well just go for medical laboratory science. See, I'm going to say that before you can study a course, there has to be like a passion, there has to be an interest in it. You don't just study medical course because you also want to belong to the medical professionals. Okay, so I want us to understand the fact that these two courses are different things on their own and they stand on their own. So like I was saying, medicine has been in existence for a very long time, and medical laboratory science is that profession that is like in the background. Like majority of patients don't even come in contact with the scientists because of how they work. In the hospital, there are different areas of the hospital section that work hand in hand. These people work together for the betterment of the patient's health or for the betterment of people that comes into the hospital. So for example, when you're coming into the hospital for the very first time, the first people you're probably going to meet are the record people. So these are the people that are going to register you in the hospital and tell you, okay, they will collect your details, give you an hospital card, and from there you probably meet with the nurses. Depending on how the establishment is, you probably meet with the nurses where they do your vital signs, get your details like your age and everything, your BMI and all those things, and then from there you probably see a consultant. So now this is where medicine comes in. You see a doctor, tell your doctor what your signs and symptoms are. Okay, this is how I'm feeling in my body, this is what is wrong with me, I'm not sure. I used to feel like this in the morning, I feel like this in the afternoon. And then the doctor or the consultant is taking note of all these things that you're saying. Now, the doctor is probably guessing and trying to guess what the problem is on your body. But you know that a couple of diseases, infections, sicknesses out there have like almost like the same symptoms. Let me set an example. If you're having ulcer, you'll probably be telling people, oh, you're having stomach pain. If a patient is also having typhoid, the person will also probably be complaining of stomach pain. So now another example, if you're having malaria, you'll probably be complaining of, oh, I'm having a headache. If your PCV is high, you most likely experience this same headache. So to be sure of what the problem is or what is going on in this patient's body, the consultant refer the patient to the laboratory. So now this is where the medical laboratory scientist comes in. So you probably or most likely not have like a one-on-one contact with your medical laboratory scientist, but trust me, something is going on at the background for your betterment. Sometimes the doctors just fill out a form, okay, requesting for a test, okay, according to this person's signs and symptoms, I'm thinking this person should go for kidney analysis. Let's be sure of what is wrong with this person. So let this person do kidney analysis. So the patient will probably take this form to the phlebotomy. So this phlebotomy, you check the form, they know that okay, this is kidney related test. There is a bottle that they're going to use to like collect samples for this particular test, and then they collect the blood sample. Now, you most likely don't come in contact with the medical laboratory scientist, like I said. So this sample, where is it going to? It is going into the laboratory where medical laboratory scientists are going to make analysis on this blood sample that has been collected from the patient and make the necessary test on it to help in diagnosing the disease. So now when the result is out, the patient collect the result from the reception and then take it back to the consultant. Now the consultant can be sure of what is wrong with the patient, not just assumptions. Do you understand now? So medical laboratory science is different from medicine. It is not an alternative to medicine. So if you want to study medicine, be sure you are studying medicine. If you want to study medical laboratory science, be sure it is medical laboratory science that you are going for. Not like, okay, I don't have an option, let me go and study medical laboratory science. Medical laboratory science is also known as basic medical science, in case you are not Nigerian. In other countries, it's commonly known as basic medical science. These people analyzes biological specimens from the patient's body that is in diagnosis and monitoring of diseases. Some of the biological specimens are blood, urine, sputum, stool samples, semen, tissue, and all that. Some of these samples are what are collected from the patient's body to analyze what is going on in the patient's body. So when the result of a particular test is out that concerns a patient, then the result is taken back to the consultant. The consultant can now be sure of what is going on in the patient's body, and then this will help to determine if the patient would be admitted into the hospital or not. So now if it is like a critical condition that needs monitoring and the patient has to be in the hospital, the patient needs monitoring. So for the monitoring of the patient, so let's say there are some treatment that has been done on the patient, there are some drugs that has been given, there are some things that has been done on this particular disease. For monitoring to know if this patient is responding to treatment, there's going to be like a continuous analysis. So which means the laboratory scientists are going to also keep helping in the monitoring of this patient's condition. So maybe like after two days, depending on how critical the patient's condition is, or maybe every day, samples are going to be sent to the laboratory for monitoring. So imagine a laboratory scientist that has the details of this patient. The medical laboratory scientists are not seeing the patient. All they have is the details like the age, the sex of the patient, and maybe a queried condition, and then maybe the diagnosis now for monitoring, in case of monitoring. So they can like say, oh, few days ago this person has a creatinine level of so amount, and now okay, this person is responding to treatment. So they also helps in like monitoring of diseases. So you can see that medical laboratory science is a profession on its own, medicine is another profession on its own. They both come together, work hand in hand for the betterment of patients. Not like this one is a second choice or this one is a second choice to this one. So if you want to study this, be sure you have passion for this. If you're studying this, be sure that it is what you want to go for. Don't let someone confuse you and say, oh yeah, if you can't study medicine, you can study MLS. It is not the same thing. It is not an alternative. So medical laboratory science is not just medical laboratory science. We have like different areas in medical laboratory science, just like there are different areas in medicine. In medicine, I think there are obstetrics and gynecology, there's pediatrics, there is surgery, there is all those things like that. And in medical laboratory science, we also have different areas. We have the histopathology, we have the hematology, immunology, virology, we have the chemical pathology, we have the microbiology, parasitology, virology, and we also have the hematology, the blood group serology. You can see that it is a very interesting profession on its own. We need to become a medical laboratory scientist, just in case you're thinking what the requirements are. You need to be a science student from your secondary or high school, whatever you call it. You need to pass at least 5 subjects: the mathematics, English, chemistry, physics, and biology. You also need to be in school for 5 years in university. So the course is 5 years in university, and then during your course of study you're going to write 2 professional exams, because the course is being regulated by the Medical Laboratory Science Council of Nigeria. So you're going to be writing 2 professional exams, one in 400 level, the second one in 500 level. This one in 400 level has to entails like the whole thing that you've been taught from 100 level to 400 level, and under the specialty of histopathology, hematology, microbiology, and chemical pathology. But when you get your 500 level, you're going to specialize, like, okay, what is your area of interest? What areas of medical laboratory do you really like? So for example, I am a chemical pathologist. I specialize in chemical pathology because of how I love that area. So in my second professional exam, which is going to happen in 500 level, I am to write exam based on this specialty alone. So compared to 400 level, where you're writing professional exam based on everything that you've been taught. But 500 level is a different case, and after you must have passed this, you're going to be collecting a provisional license from the Council of Nigeria, which will be given to you on your oath and induction day. So after this license, you are going to go for a compulsory internship. So this is going to happen for a year. It's like a working training, something that you have to do in like hospitals. This is like you still training, but then you're getting paid. So after this, that is when you'll be able to like go and apply for your original license. So the license that is given to your induction day expires in months. So the other one is the one that now certifies you to be a medical laboratory scientist. It is after this internship that you can now go ahead for your NYSC if you're a Nigerian. Medical laboratory science is a very interesting course. It is also known as the bedrock and background of medicine. If you have any other question that you want to ask me about medical laboratory science, I'm here for you. I'm here to answer your question. If you enjoyed this video, please give this video a thumbs up. This is very, very important. Subscribe to my channel and also drop your comments in the comment section below. Let me know what you think. Until next time that I'm going to be seeing my face again, stay cool, stay calm, and be happy. Bye guys.